Good afternoon. I'm Dr. Jaime Estrada. I'm the president and board chair of Texas Doctors for Social Responsibility, TDSR for short. I want to welcome you to our second public health conversation on reforming the foster care system in our state. This time, we are honored to have a panel of experts on the issue, including Representative Ina Minjarez, who will be the moderator, Senator José Menendez, we're happy to have you back. Also in the panel, TDSR Advisory Board member Lauren Geraghty and Dallas attorney Catherine Estrada. Yes, she's my daughter. As many of you know, there were two articles about the broken foster care system in our state in the Express News this week, both in the same day, Tuesday, January 11th. The main one reported on U.S. District Judge Janice Jack scolding state officials about the conditions of the state foster care system, as reported by a panel of out-of-state experts who recommended specific fixes to Texas travel foster care system after a new report documented overwork and untrained employees, unfurnished and dirty facilities, and violent situations involving children. Judge Jack asked the state officials to commit to the expert panel's recommendations. Did they do it? Apparently not. In the end, the state agreed to implement a few immediate changes, but most suggestions were to be forwarded to Governor Greg Abbott. In the other article, a woman was taken to jail after police found two toddlers who were placed in her custody, who were found abandoned, dirty, soiled, crying, one of them tied to a crib in her place. Police Chief McManus said that the woman was the children's temporary guardian after they were taken from their biological mother. The children were taken to the hospital and later turned over to CPS. Our medical community is extremely concerned about a foster care system that promptly separates children and adolescents from their parents and places them in risky and unhealthy conditions to be taken care by strangers, and many times by overworked, untrained, and poorly paid CPS workers, without first addressing and properly investigating the root causes of the complaint. We appreciate and thank our speakers today for their work to change the system at the legislative, school, and family court levels to help the families who are thrown into this rather inhumane system. Representative Minjarez.
Thank you, Dr. Estrada. It's wonderful to be with all of you this afternoon. My name is Ina Minjarez, and I currently am the state representative in House District 124 right here in San Antonio. I am an attorney, and I spent much of my practice representing children in the foster care system here in the Bexar County Children's Court. I also represented parents who were facing termination of their parental rights. After seeing some difficulties and concerns in the system, I made a commitment that while I was at the legislature, that reforming the foster care system would be at the top of my priority legislative list. As a result of the federal lawsuit that Dr. Estrada talked about, in the 2017 legislative session, I was assigned by then Speaker Strauss to begin working with a work group of bipartisan legislators to start working on reforming our foster care system. And I've continued that work to this day. So I am very honored to serve as the moderator of this panel this afternoon. And I have the honor of presenting our panelists. This afternoon, we have Senator José Menendez. We have with us, he is the state senator for District 26. We have Lauren Geraghty, Chief Strategy Officer for Communities and Schools. And we have Catherine Estrada. She is a Dallas County Public Defender's Office. Senator, we're going to start with you. Can you please tell us a little bit about your particular experience with the foster care system and the great work that you've done at the legislature?
Thank you very much, Representative. First of all, let me thank you for everything you've done and all the efforts and the teamwork that we've had, you know, and especially the focus on those the grandparents and others who have not been given the same respect and the same financial help to keep those families together. And so there's a lot that can be done, and I've always enjoyed working and making these things possible. So let me thank everyone, say good afternoon, and let everybody know that Thank you for giving this the time. Foster care system, as we know, is in a crisis, and it is something that we've seen, unfortunately, over the last decade, but it's gotten worse throughout this pandemic. And over the past year, Texas has lost over 1,000 foster care beds, and the number of children without placement has increased every single month since the beginning of 2021. Think about that, every month for the last year. And so during the second called special session, we added funding to address the foster care capacity crisis. And while this was a step in the right direction, there's still problems that need to be addressed within the system that go beyond the capacity crisis that will, in fact, help us work on the issue. We need to focus on providing children with the care and the best resources and services, especially trauma and mental health services. People often blame the rise in children without placement on a lack of providers willing to serve children with high acuity. This is a huge issue, and we're seeing the lack of an inability to access mental health services as a root cause of children without placement. And the report that came out earlier this week from the panel of experts on the foster care system denounced the state's mental health care services as woefully inadequate and urged our state officials to improve specialized care. They mentioned the core failure is the absence of the fully developed system of care, including home and community-based resources, targeted and well-resourced treatment, and and one of the recommendations from the panel stated that Texas should establish a statewide system to provide mental health services for children. And this is the type of initiative that can help kids in care with their parents, especially if they would have the right resources. Part of the problem is that since 2017, there have nearly been 4,700 children whose parents have relinquished custody due to their children's behavioral and mental health issues. And if we provide these parents and these family members and caregivers with the tools and the resources necessary to help their child with the behavioral and mental health issues, this would allow us to solve a lot of the problems at the root and make sure that the children aren't separated and aren't left behind. Another issue highlighted by the panel is something that you, Representative Minjarez, you and our office have been working on in the past, and that's the prioritization of kinship caregivers. Time and time again, it's been mentioned that children who stay with family, as opposed to going into the foster care system, we know have better outcomes. And so many of us know grandparents, aunts, uncles, or older siblings who've stepped up to take care of the family. And while we're able to get them more assistance through the TANF, through temporary assistance for needy families, payments through the bill that you and I worked on together last session, SB 263, they're still receiving a minimal financial assistance from the state. And there has to be substantial funding for foster care providers and building capacity. We've not increased caregivers' financial resources. And so in the state of Texas, kinship providers are paid $11.55 a day compared to the rates for foster care getting from $47 to $92 a day. So additional funding is something that we have to continue to work on. We know that we've offered amendments, especially during the American Rescue Plan funding. We wanted to see if we could provide more money for kinship. The difference has been made clear to us that Texas has to prioritize the use of kinship caregivers in addressing these issues. And we should be encouraging and supporting placements with family members. And we do this by providing them the right level of support, training, especially for family members. You know, that's the thing, that we provide training and we require training of a lot of foster care, but we don't necessarily provide those specialized services to the kinship givers. It doesn't make any difference. If you haven't been a parent for a while, you need the training. And while we're going to keep working on these issues during the interim, we've been assured by leadership that the foster care system will be made an interim charge. We still have a lot of work ahead of us in order to tackle the root causes of child abuse and neglect. And this report being released, it's my hope that state leaders working with those and legislature and all the stakeholders will work together to find solutions to help these kids. And so I just want to thank you for the opportunity to keep working together. And I want to thank Dr. Estrada for bringing us together with the medical community, because this is a health crisis issue.
Thank you, Senator, so much for all of your hard work. And that was a great synopsis of all the work that needs to be done, what's been done in the past, and definitely what needs to be tackled in the future. Lauren, if you would please tell us about your experience with Communities in Schools. I know that is an organization that is very near and dear to Senator Menendez and my hearts.
Yes, and I'd just like to express my gratitude for being invited to speak with such esteemed advocates. I think the amazing work that has to happen both at the policy level and the direct service level is critical to really move the needle and make those systems changes that we need. So when I think about the work of Communities in Schools, right, we work directly inside schools, identifying students who meet a number of different criteria that the TEA, Texas Education Agency, calls at-risk criteria, which means these students are at risk for not completing their K-12 journey. But more intentionally thinking about foster youth, we've seen that when we work with youth who are identified as, McKinney-Vento students or in the system of care, those wraparound services that our agency can provide directly in a school campus, they include everything from basic needs to connecting them with mentors, to connecting them with the internships, but also we provide mental health services directly on a campus, so we're removing access barriers. So in that way, Communities in Schools is really able to effectively tailor those needed supports to a student in real time, and they are consistently available to those students. It's not dependent on time, travel, it's not dependent on treasure, right? Like having the funding to access those services. So I think also in my work as a member of the St. PJ's governing board, being directly connected to an institution that serves those who have been removed from their homes has greatly illuminated my understanding of just how much of the complexity is really at the funding level because of the sheer size of the Texas foster care system. Next to California, we are the largest as far as number of youth in the system. I think the last data I saw was 2020, and it was just under 30,000 youth in Texas were in the foster care system. And we're talking about a system that only then has around 11,000 certified foster homes. So there's a huge disconnect between the level of need, the number of providers, and then just the funding that it'll take to really provide earnest, high quality foster homes, let alone talking about all the prevention services. So I think for me, and just as a sheer fact of the work that I do, I'm coming at this from an upstream perspective. How do we prevent people from having complexities that require them tripping into the system to begin with?
Thank you, Lauren. And finally, we have with us this afternoon is Catherine Estrada, Dr. Estrada's daughter. I really appreciate the work that she does, because I've also been in the trenches of the legal system. So Catherine, if you could please introduce yourself briefly and talk to us about some of your work that you do as an attorney in foster care.
Thank you, Representative Minjarez. Basically, I started my career as a prosecutor for CPS, and I was working in Hidalgo County for about 5 years doing that, and was able to kind of see the breadth of the issues just concerning, children that are coming into the foster care system. And of course, when you're thinking about the state of Texas, each region has kind of region-specific issues that come up more often for the families that are involved with their foster care, placements. And right now, I'm working in the Dallas area as an assistant public defender. I have about 50 CPS clients right now on my docket, and I represent primarily parents in removals that are filed by the department and in participation cases as well. I also am still attorney and guardian ad litem on a couple of cases out of the juvenile courthouse. And so I kind of have been able to see the situation on both ends, having been a prosecutor and representing CPS, and also now representing mainly parents in these cases. And I think my biggest, concern at this point is, preventing the legal intervention aspect of these removals, because, we wouldn't need to get into these conversations about, the foster home availability and, placements and all these kids that are in CWAP right now without placements and living in hotels, if we were dealing with the issues that led them to become involved with the court system. And so I think, if anything, I have more insight into that aspect of it.
Well, thank you for the work that you do. And I think it's really important to note that, when a parent or guardians are accused of abuse and neglect, they are entitled to due process in the legal system. And so I think that's really important. And I'm glad you're here to talk about that this afternoon. Because our panel has an array of experience in legal, in policy, and in social services, what I want to do is definitely give our audience an opportunity to engage in the conversation, but I want to break up this conversation into 3 parts. 1, discussing the symptoms of the current foster care crisis. 2, diagnosing the issue. And 3, prescribing solutions. So to begin with, let's talk about discussing symptoms with all of the panelists. Let's start with, this question is open to each of you. What do you think are the biggest issues facing the child welfare system as a state right now? And I know Senator Menendez, you talked about some of them, but if all 3 of you would like to point out what those may be in your perspective. Senator Menendez, why don't we go with you first?
Okay, absolutely. I'm going to pull over real quick here. And Representative, you more than anybody, especially now, know how hard it is to be in multiple places at the same time, right?
We're good at multitasking.
I'll tell you what. So look, one of the biggest, because there are many issues facing the welfare system, is the conditions that these kids are in once they get in. And I think, Attorney Estrada was accurate in what she said. We're not addressing the reasons. There's a lack of mental health care. Look, lots of parents, myself included, you look out, you reach out, you find the therapist listed on if you have insurance, and they don't always call back, and they'll tell you they're not taking new patients and they're booked, and you can't get an appointment until when. Our system is completely overwhelmed, and the impact is on the kids. We're not dealing with poverty related issues, so we're having upstream preventative. So when you have poverty and you have a lack of insurance, it makes it that much harder to access resources. And so that's part of the problem that I see as well, is that a lot of these are because so many of the families are in crisis because they're living paycheck to paycheck, because they're not able to have a job, because they're having alcohol and drug dependency issues sometimes. So pulling children from their home communities and out, it impacts their physical and their emotional well-being. It's unacceptable. And it doesn't just hurt the children, it impacts the family. And it just exacerbates the problems at home. And so we hear about children being in unlicensed facilities where they're being supervised by untrained staff. I mean, so if they're going to be in that scenario, why not keep them if they can be in a safe condition with a family member? And many of the facilities have been seen to be dangerous and potential to put kids at risk, when they can run out into the road, or, we've seen how many children have been run over because they've run away from the hotel settings or their office settings. And so every decision we make has got to be made with the child's welfare at stake. And that's got to be the key. But I think that it can boil this down to this. We need to look at the root causes and wraparound services for the whole family. If we address the issues that are impacting the family, whether it's poverty, whether it's alcohol and drug dependency, whether it's domestic violence, then we can improve the home situation so the kids don't have to be removed.
Thank you. Lauren.
Yeah, I can only echo everything Senator Menendez said. I think there are really amazing evidence-based programs that do the early identification work, right? Like and it's appropriate for TDSR to be hosting this conversation, because if we can think different about what pediatricians are screening for, even before pediatricians, what are OB-GYNs screening for? How are we identifying at-risk parents potentially when they come in for their prenatal services, right? How are we increasing the number of those who access prenatal services first? But then how are we maybe developing a tiered system of support for new parents, especially who maybe never had a child before, so that we have different levels of support we're providing those parents, depending on their complexities, their environment, what's going on. So similar to home visiting programs or nurse family partnerships, how are we expanding those to be far more universal? And then that way, not only are they, is their eyes on the people who are going to be raising children, and that feels very big brother, I understand, but I do believe that having those earnest conversations before the child ever enters the world, or as early as possible with those pediatricians, could make a huge difference for preventing some of these people slipping into the system.
I agree. Prevention is so key. Catherine, what about in your perspective in the legal field? What do you think, from your opinion, what are the biggest issues facing the child welfare system in the state right now?
You know, I really did look at some of the statutes just recently about that came about this last legislative session with the House bills that were passed, and I know you were responsible for one of those important House bills that made some changes to our Texas Family Code. And to me, the biggest issue that I've been seeing most recently is the fact that even though the legislature is passing all of these House bills to try and keep families together and, you know, make things more restrictive with CPS in terms of their burdens and what they need to show in order to have these children being removed and taken into the foster care system, it seems that we're finding that CPS seems to be kind of thwarting a lot of those efforts by passing internal policies that restrict a lot of the leeway that was created by some of these House bills. For instance, the marijuana House bill, the one that talks about the fact that just a positive for marijuana is not legally sufficient for a removal. That's not harm or abuse in and of itself. But for CPS purposes, you know, if someone is testing positive and they've had a prior referral within the last 12 months, they passed a policy that they cannot be referred to services again. And so we're actually seeing a lot of more cases since this past September 1st that are coming in as emergencies, but they're really non-emergencies with positive drug tests. And so it's becoming an issue that we're still getting risk-based removals, which was the whole purpose of taking out 262.113.
Well, thank you for putting that on alert for Senator Menendez and his staff and myself. We appreciate that. My next question specifically is going to go to, again, Senator Menendez and Lauren specifically. Senator and Lauren, what can the San Antonio community do to support the work you do and the kids that are involved in the system in our community?
Lauren, why don't you go first this time, since I went first, and that way you don't have to echo, I can echo you possibly.
No, that works for me. Thank you, Senator. Support the community-based organizations that are doing the work, whether it's the intervention work or the prevention work. CPS, DFPS, right? They're doing the case management, they're doing the removals, but when it comes to the healing services, when it comes to the training, the education, the actual shifting of mindsets, right? And the provision of services, whether it be, again, basic needs or mental wellness, we're talking about community organizations. We're talking about agencies in the community like Catholic Charities, like communities and schools, who every day are working with families to address these issues. And so thinking about what are the nonprofits in your community who you can volunteer for, you can donate to, you can elevate and spread awareness about, because right now we know the state is not funding this at anywhere close to an appropriate level. And so just circumventing that and going straight to those organizations and directly supporting them would make a world of difference.
So all I can add to that is that absolutely, that's a great idea. The other thing is, anytime that you're interacting, think about how do we keep children, what do we need to do to keep children in a safe environment with a family member? So there are organizations that are centered around that, like Texas CASA, Grandparents Raising Grandchildren, And as a community, I think we need to rally around them, get involved, develop pilot programs that focus on the caregivers. Because look, in my opinion, it's critical that we provide support resources to the families, just like we have with the foster families. But these families, these caregivers, they feel they have the bond of family, but they want to do the right thing, but they may not have the financial resources, the tools, the crib, all of the things that they need. And we need to do what we can. I already talked about the disparity and how much, kinship gets, a little under 12 bucks, where, foster gets anywhere from $47 to $90 a day. So if we support these nonprofit groups, then we can help those kinship. The other thing is there's a lot of attention paid right now to getting the kids out of unlicensed facilities and placements such as CPS offices. But our efforts need to be make sure. That's why we have to redouble the efforts to help them stay with families and develop programs and initiatives to allow those families to have the tools that they need to be able to take care of that family. And sometimes it's as simple as a crib and diapers and formula, but other times it can be more, a little more intense than that.
Thank you, Senator. My next question is going to be for Catherine and Lauren. You both are the boots on the ground. You're on the front line. And so my question to you both would be, what information or message would you like for our state leaders to know in terms of resolving the foster care crisis? Catherine, we'll start with you.
That's a very, very large question because it is so multifaceted, the needs of the population, the populations that we're dealing with. I mean, it seems like a couple of the things that have been mentioned are specialized services and placements with family members. And, with specialized services, they need to be specialized not only for the children, but also for the parents. I have a lot of clients that have permanent intellectual disabilities, and even with a quote unquote tailored service plan, there is no service providers specifically that are providing for those clients that have low IQs and severe mental health issues. That's also a big hole right now that we're seeing. They're being referred to general public metro healthcare facilities and seeing someone different every month that they go. Also, we're seeing that problem with extensive parenting courses. I have quite a few clients that, they just have never been taught how to clean their house properly, for department standards. But it's definitely a lack of service providers. And also, in some ways, the qualifications that people are having to meet in order to be approved as family placements is also an issue that we see a lot. I mean, if they have a prior criminal history, a misdemeanor from 10 years ago, or a CPS case from 18 years ago, they're not going to qualify as a kinship placement, and CPS is not going to approve them for placement. So, some of those things, could be rectified, but again, some of that is also CPS policy, not necessarily the law. So I think, if anything, the bigger answer is that a lot of the CPS policies need to be modified and reformed to meet the needs of our communities.
Thank you. Lauren.
I think there's also the complexity of the services cliff that happens once, ideally the youth have been reunified with their families. Then all of a sudden those complexities go away, right? They're no longer eligible for the child care support. They're no longer eligible for the mental health services, things like that. If the child is adopted, ultimately same goes there, right? We are not doing a good enough job of making sure that all of those supports and services that ideally are put in place during their time in the system, they sustain after the children and the families are in a more permanent place, right? So I think that's something that we need to talk with our state and or federal legislators about. On top of that, just I know that there are some complexities with the Family First federal funding and what it can and can't be used for. So again, advocating and really making sure that those flexibilities that are needed, reducing as much of the red tape as possible in order to make sure that the funds get to who they should go to at the right time and the right amount.
Thank you, Lauren. Now, my next question is for Catherine. So, Catherine, your work as an attorney is so critical, and not everyone has a view of what the legal system is like. So I'm really curious if you could share with us and the audience, in the unique position that you're in, can you tell us how the court system, interacts with the child welfare system? For example, what is CPS Family-Based Safety Services Department? What is that? What is its function? And I'm curious about your caseload. How many cases are you handling where you have separated families?
So basically, the way that CPS interacts with the legal system pretty much varies by region. If you're ever curious, most of those courts are live streaming YouTube right now, and you can actually log on and watch their CPS court, which is kind of interesting. And in preparation for today, I actually did that, and I went on and I watched some of the other proceedings from other counties, and I found that it was largely county dependent, because of the fact here in Texas, we have specialized courts that are run by the Office of Court Administration that deal with CPS cases. And then we have some counties where their district courts are dealing with CPS cases, which means you could have associate judges and district court judges. Now, my caseload in Dallas County is extremely large right now, and it's gotten larger towards, I would say during COVID, it got substantially larger. The majority of my clients used to be child support enforcements at some point, and that number has changed quite dramatically. Right now, we're seeing, I'm getting a parent on every case that's filed in the 256th District Court out of Dallas County. And I'm basically getting 2 new clients a week. And so that means that we're getting 14-day settings, pretty regularly right now, which is a lot more than we were. As I said before, right now I have between 50 and 55 active CPS parents only. And it's a lot. They need a lot. And when we say that, they need specialized services, they're looking to us, the attorneys, their attorneys, to help them, well, what can I do now? What can I do now? And we're finding that it's just, there's a lot of difference between what the law is and what is being applied by CPS and the judiciary in a lot of these counties. And a lot of them are not making CPS meet their burden, especially on some of these legislative changes that came about September 1st. And so that's been a big problem. And essentially what that leads to is a lot of contested 14-day hearings. And I've been contesting all of them, because if the law changes, then they need to change how they're doing things as well. And we have not yet seen that change, unfortunately. And when you're dealing with a system where a lot of these decisions are being made subjectively by program directors, by supervisors, and by very inexperienced caseworkers due to just the sheer turn from CPS, even when it's being pointed out to the court that they have not met their burden, a lot of removals are still being granted. And so again, that comes back into then we're taking up foster homes and we're taking up placements and RTCs, and we're finding that a lot of the kids are being placed in more restrictive environments than is necessary because they don't have the availability of foster homes. And so it's a big problem. It's a big problem right now up here, and I'm sure across the state. And if something's not done in order to create more remedial services, kind of like the House bill that was passed for the pilot program for the family-based services, CPS has family-based safety services right now. But my understanding is that they're in the process of dismantling that unit of themselves, which is going to be pretty catastrophic, considering that was the unit that went out and offered services, did safety plans, tried to prevent the removal. And so what we're seeing is that since the law changed September 1st and they can no longer file at-risk removals, they're basically going in and within the 30 days of their investigation, they're gathering enough quote unquote evidence to substantiate petitioning the court for emergency removals. And most of them are being done without a court order first. And they're just presenting the ex parte the next business day. So there's not a lot of chance for us to be able to fight before the kids are removed. In other words, they're removing and then we're having to figure out how to fight it. And considering that they're entitled to a first reset, it could be up to 30 days before you actually get a contested hearing on some of these cases. And it's a terrible thing to put certain families through, especially when there was no discernible abuse or neglect in the home.
Well, that's really concerning to me because as legislators, we've been working to keep families together. We've been working on legislative measures to ensure that it stops unnecessary removals. But from what I'm hearing is that although we're passing important policies and bills to prevent unnecessary removals, the department is working around us with internal policy decisions and still moving forward on unnecessary removal. So that's very concerning to me, and I'm sure concerning to the senator as well. So thank you for sharing that with us. What I want to go into next, and what I want to shift into is after talking about the symptoms, is diagnosing the issue. So now I want to ask you, Lauren, specifically, what are potential short and long-term impacts on the physical and mental health of children who are in foster care?
Yeah, I'm about to really depress everybody on the call, and I apologize. Many of you are well aware of this though, because you're either serving them or you're advocating on their behalf. But if it's just a short interaction, right? We know that youth who interact with the system at the time of like their first moment of interaction, typically they have 4 or more ACEs, adverse childhood experiences, right? Which means that at that point in their life, they've already experienced enough trauma and complexity to potentially have impacted their brain development, right? That can change the way that they take in content when they're in school, that can change the way that they behave, that can change their physical health long-term. So those who enter the system are already at a disadvantage many times because of the complexities they've experienced. And then we know the system exacerbates the issue. So there was a research done in 2016 out of University of California, Irvine, that showed that comparing youth who were in the system versus those who had never been systems involved, they were 7 times more likely to have clinical depression. They were 6 times more likely to exhibit behavioral issues, 5 times more likely to have clinical anxiety, 3 times more likely to be diagnosed with ADD, hearing or vision issues, and 2 times as likely to suffer from learning disabilities, developmental delays, asthma, and obesity. So we know the system exacerbates the issues for youth. And then when you think long-term, when you think about the youth who age out of the system, regardless of whether they age out at 18 or 21, or even a little bit later in some states, we know that the stats related to those who never found permanent placement, who never found attachment, belonging, a family, right, that they could lean on, almost immediately, 20% of them will become homeless. Within the first 2 years, 60% of them will have an interaction with the judicial system, and 25% will be incarcerated. 60% will be convicted of a crime at some point. 60% of young women who age out end up in the sex industry. It's just heartbreaking on top of heartbreaking on top of heartbreaking. And so we know that it's not even about increasing the number of foster homes, but it really is about decreasing removals as much as possible and increasing high quality practices like kin care.
And in that same vein, Lauren, so talk to us about the great work you do with communities and schools. How are you getting involved? How's the agency getting involved to serve children in the foster care system?
So again, because we work directly in schools, we communicate very effectively with school principals, other administrators, counselors. We work at the district level with social workers and other, clinical level staff to really identify and then make sure that students are getting that right level of support. Many people know that as students enter the system, they become highly mobile. So to the best of our ability, making sure that we're reducing the consequences of that mobility to the best of our ability. Every time a student moves during a school year, whether they're in the system or not, they are pushed back 6 weeks in their learning, right? And so how do we make sure that we are, to the best of our ability, preventing the impacts of that high mobility, really leaning in with high quality, unconditional love, right? For many of these youth, they feel disconnected from any caring and competent adult. They're being served by a plethora of different adults, whether it's CASA or it's their CPS social worker. So really helping schools also better understand what having a trauma-informed or a trauma-sensitive approach means, so that the ecosystem that these youth exist in is a very caring climate. So it's not only just direct service to the students and families, but it's also making sure that the whole school is really ready to provide those trauma-informed services.
Thank you. So what I want to get into next, for the sake of time, is the third component of our talk today, which is discussing prescribing solutions. Catherine, you did a wonderful job in the short amount of time to describe some of the concerns you have with the legal system and your role in having to navigate on behalf of parents or guardians facing the termination of parental rights. One of the things you highlighted was, parents who are required to take drug tests. Can you talk about how reliable those drug tests are, specifically the hair drug test?
I don't know if I want to talk about reliability in front of a bunch of doctors, but, I mean, what the issue that we're seeing with the drug tests is that, number one, CPS is not informing the parents that they do not have to take a drug test, that CPS can obtain a court order for the drug test if they really want one. And so what we're seeing is that they are blanket drug testing all the parents when they go out and interview these families. So even on cases that are getting referrals for issues other than drug use, they are showing up before the investigative stage is closed at that 30 days and saying, in order to close your case, my supervisor wants a hair follicle on file for you. And so they're doing 90-day drug tests on all of these families. And basically, if at that point they're testing positive, then again, they're looking at the policy to see whether they can be referred to services or whether they're filing removals. And the problem with the drug tests that they are doing, number one, is that it, again, is region specific. So some regions are doing hair follicles and UAs, and some courts are allowing oral swabs that are actually done by the caseworkers. And so you can already see kind of the reliability of that kind of testing. Now, the issues that we've seen with the hair follicle drug testing in particular is that these facilities are contracted through the department. And so our clients are not allowed to choose the testing facility. They have to be sent to a facility with a 2054 where CPS sends them. Now, we've had, just in the past 2 years, I myself have had 6 clients get false positives on hair follicles for serious drugs like cocaine or methamphetamines. And then they get resent 1 week later and their results are completely negative. So is it the testing facility? We've done our best to kind of try and hone in on the ones that we think have bad practices. But it's definitely been an issue that we've had a lot of clients that have come in and said the guy wasn't wearing gloves, who took my hair, the instrument wasn't sterile, he picked the scissors up off the counter, I didn't get to close the collection specimen bag, which they're supposed to do for chain of custody. You're supposed to be able to see your specimen with your name on it. And then, of course, they get retested by a different facility and they're testing negative. So when you actually look at the qualifications of these individuals that are taking these samples from our clients, it's literally like a 5-week training course. It's not a certification. It's not an associate's degree. There's really no qualifications necessary. It's a training. And so I think we've had a lot of issues just with whether or not those tests are reliable and whether or not they're factoring in exposure positives. Which are basically if the person was exposed at some point to the chemical, say, for instance, sharing a work hat on a construction site with someone. It sounds odd, but there's actually literature on it.
And that's all of that's really concerning. But you talked about uh, the extreme caseload you have. You talk about the number of families you're representing who have been separated. Um, how hard is it to reunify those families? I mean, what has been the success rate for you, and have the majority of your cases been where there's just been an outright termination?
I think it's largely case specific and issue specific, unfortunately. But truthfully, I see more of the cases go to termination when the parents have substance abuse issues concerning things like meth or cocaine, some of the more highly addictive drugs. Those have mainly been a lot of my termination cases lately, is substance abuse issues that were not alleviated during the legal case. But in terms of reunification, it, again, that a lot of that is judge specific and county specific, because CPS does not actually have a policy as to how many drug tests need to be on file that are negative before they can reunify a family. So at that point, it's, again, a supervisor or program director saying, okay, she's had 4 clean UAs for marijuana, that's enough to start a monitored return. But what we see a lot of, which is a little bit disconcerting, because of course we always want families to be reunified as soon as possible, is that a lot of the judges have been requiring at least 6 months of negative drug tests prior to returning the children. And we're not talking about a return and a dismiss. We're talking about generally a monitored return, which means that their legal case continues for another 6 months after that. So in essence, before you're going to trial, because of course the CPS case needs to go to trial within 12 months of filing of the petition, you're basically saying that they're having to establish a 1-year period of sobriety prior to a trial setting to actually have a final order in the case. So it's a pretty substantial amount of time.
Thank you, Catherine. Senator Menendez, I think it's really important that we talk about what the last legislative session was like, specifically in regards to foster care issues. What were the missed opportunities or issues that the legislature needs to take a second run at during the next legislative session?
Yeah, there are quite a few things that we need to continue to work on. But before I go on, I want to just address something that Ms. Estrada has been mentioning that has been really concerning to me. She's like, we pass a law which has jurisdiction over any agency policy, and yet the agencies are ignoring our laws in favor of what they believe they deem they know is best. So if you could help us, you or anybody on this Zoom, by giving us the specific examples, and we're not going to use your name, we're not going to say so-and-so told us, but we definitely need to know where the agency is ignoring state law, because those are things that it doesn't matter if we go back into session and pass the laws if they're going to be ignoring them. And I mean, that's just unbelievable and disheartening. So, the expert panel made great recommendations to DFPS that they should take now to eliminate children being placed in unlicensed care. One of the things they mentioned was creating a leadership position in DFPS to be the leader in an interagency team to address this issue. They also recommended assigning clinical coordination services to all youth who are currently in unlicensed care facilities. The primary responsibility of these coordinators would be to establish trauma-informed staffings and individualized plans for every single youth in their family. Everybody in the house needs to have services. Taking these steps now would be critical to help our kids in these facilities, and the ledge must offer all the support necessary from DFPS to make these things happen. I mean, look, if we don't invest the money on the front end, we're going to be, Lauren gave us the sad statistics of where people are going to end up. They're going to end up either homeless or in the criminal justice system, and we're going to end up having to take care of it on the back end. As far as the next session, I think we need to examine strategies that are going to strengthen the quality of care provided to children who are in the system, especially those who have the complex needs, the high acuity. We've heard us discuss the horrible conditions that many of these kids are in because of the lack of treatment. And family court judges in this county have taken an initiative to find an overlooked family member, a trained foster care family, or some other appropriate placement for these kids. As a state, we need to institutionalize these practices. We need to say, we need to put an emphasis on finding a family member or a trained foster care family that can help. And we also, as a state, need to be recruiting and extending services. But the most important thing is, how can we do wraparound services to address poverty and drug and alcohol issues in our communities? Because I think if we address those issues early on, we won't have as many of these cases to deal with.
Thank you, Senator. And I think one of the things that I want to share with the audience is the fact that, and you touched upon it throughout this conversation, or the children without placement, the CWAPs, because it's a major problem that many of these children, the foster care kiddos, hundreds are being placed outside of the state of Texas. We have them in Oklahoma, we have them in different states. And that is very concerning because the state of Texas took custody of these kids. And so I'm hoping that that is something that you, Senator, will hopefully be our voice on and address in the next legislative session. But I wanted the audience to understand that, you know, as the department is taking custody of these kids, and if there's not placement, they are taking them into other states, away from family, away from the life that they know. And that is very concerning.
Yes, 100%. You've got my commitment to be the voice, not only for these children, but for the families that they come from. We as a state, and leadership in particular, has not focused enough on the foster care system. We have not done enough, even though over the last 2 years, we've increasingly relied on placing these children in unlicensed placements. We don't even have enough unlicensed placements for these kids. That's why they're going out of state. And so while we did pass Senate Bill 1896 by Chair Kolkhorst and Frank, the past session, forbidding the department from housing a child in an office, the CWAP is still rising. And so it's critical that our state and our leadership takes the recommendations from the expert panel on how to handle this situation in the short term. As for the efforts I'm going to take with my office, we're gonna jump on top of this by urging both the Senate and the governor to call a special session during the summer to address these issues with the foster care system. We've offered 4 amendments to Senate Bill 8, the ARPA funding bill, in order to help the foster care crisis. We sent a letter to the Lieutenant Governor asking for these to be made an interim charge, where we were assured they would be considered. The solutions included examining the implementation of a new department data system. DFPS does not know where our kids are. They don't have the data system to give you exact, when someone's come into the system, exact knowledge, accurate day-to-day where people are. We need to examine ways to continue to support kinship caregivers, even though they did not see an increase in funding payments and have already limited amounts of financial assistance. We need to examine increasing pay or one-time bonuses for frontline child-serving staff in the children welfare system. And finally, we need to examine restoring funding levels for the PCS, the Purchase Client Services, which support the children in many stages of service, including achieving and sustaining permanency, which, as we heard from Lauren at Communities and Schools, how important finding a sense of family is.
Thank you, Senator. And I'm going to direct the last question to Lauren. What do you suggest for policy solutions like trauma-informed care that would help communities and schools better connect with children and their families?
Thank you. Yeah, I think trauma-informed practices are essential. In San Antonio, we're incredibly lucky that we had a director of our local Metro Health District who instigated the South Texas Trauma-Informed Care Consortium, because this isn't just a medical issue. This isn't just a school issue. This isn't just a CPS issue. This affects all of us, right? And so how can we all better understand how our life experiences, our environments, how do those really impact our current health and wellness and the future health and wellness of our community. We know that as a country, we spend $3 trillion a year on downstream health issues that could be prevented, that could be mitigated way, way, way further upstream. So yes, I think it is important for especially people who work with youth, have their own children, run into children at HEB, I don't care, please think about becoming trauma informed. But more than that, it really is taking some of these programs that we know make a huge difference and doubling down on them, right? We know that the PEI programs, whether it's the nurse family partnerships, whether it's the child youth development programs, these make a huge difference. And they're before people ever trip into the system, right? And how are we making sure, again, we're identifying those families, maybe they're school age parents, maybe there's other complexities, before any of those complexities are allowed to be made manifest. How do we really fund programs, and how do we retrain OB-GYNs, pediatricians, teachers to identify those who could benefit from those services, and then make sure we're equitably funding those services in the right communities?
Well, thank you so much. I hate that we're pressed for time. I know we could have so much more of a discussion, but we're cut to an hour today. So I want to thank each of the panelists, Senator Menendez, Lauren Geraghty, and Catherine Estrada. Thank you for all of the work that you do for our kiddos, and for being the voices of those who don't have a voice, and for being the advocates that you are. I appreciate all the work that you do, and I'm going to turn it over to Dr. Estrada. But Dr. Estrada, thank you so much for your work with TDSR, and thank you for having this panel today. You're on mute, Dr. Estrada.
Yes.
There you go.
Thank you, Ina. Well, this was a wonderful opportunity to exchange and share information, and I'm sure there were a lot of things that people didn't know about what's really happening in the system. And so I'm very grateful for the speakers to share their experience and their recommendations and on reforming our foster care system. Also, I would like to thank your attendees for tuning in and being interested in this important public health and social issue. I would like to finish with a call to action, which is for all of you to call, email, or write your representatives and the office of Governor Abbott to demand action to change the foster care system immediately. The recommendations to do this are in. Action on them is what's needed. Our vulnerable children and families in the system cannot wait. So thank you all, and have a great weekend.